Dear everybody, thank you for attending our webinar that we host from the Scientific Office, and that is about abstract excellence. We do this webinar in collaboration with the European School of Urology, and the intent of the webinar is to give you some tips and tricks on how to get your abstract or video accepted at the EAU Annual Conference. We'll also give you some tips and tricks on how to present, and we hope that this is a valuable resource for you when you come to EAU in London or one of the editions afterwards to prepare for the conference if you submit data to our annual. We'll do this webinar together with 3 members of the Scientific Office. First up is Kari Tikkinen from Finland, and he will be talking about drafting your abstract. Then we have Peyronnet, who will be talking about the tips and tricks in presentation and poster presentation. And then Frank van der Aa, who's the chair of our video committee, who will be giving you tips and tricks on video presentation. So as the current chair of the Scientific Office, I would like to seize this opportunity to give you a brief introduction on who we are, what we do, and what you can expect from us over the next couple of years. So the Scientific Office is the office of the EAU that is responsible for the composition of the EAU Annual Conference. We have 31 members, and the main sessions that we handle or compose are plenary sessions, thematic sessions, and then the various categories where you can submit your abstract. So oral abstract sessions, video abstract sessions, and expert-guided poster tours. So these platforms or these session types will get into the details later. These are the members of our office. I hope you can notice that we have quite a good balanced geographical distribution. So we want to represent each and every member of the EAU with the composition of our office. You can see the ones that partake today highlighted here. And what you can also see is we consist of 3 subgroups, so to say. So we have the Scientific Office itself. Those are the people that handle, on the left side, the abstract, the plenary, and the thematic composition. Then we have the Video Congress Office, and those are the people that evaluate and select videos for the video sessions. And then you can see we have a whole list of ex officio members of the office. And the reason we have so many ex officio members of the office is because we try to strive for goal and brand congruence in the EAU. And we want to make sure that our strategy and our policy is aligned with as many offices in the EAU as possible. Obviously, the Annual Congress is a platform for many offices. For example, the Policy Office has sessions, the Guidelines Office has sessions, the ESU has courses. And we want to avoid overlap as much as possible. Obviously, in a Congress as big as ours, it's not completely possible to avoid overlap at all, but we want to reduce it to a maximum. I'll give you some insights on our strategic key points for the next few years. We, first of all, want to ensure that the organization is the leading global platform in urology dissemination. And some of the actions include to enhance the Congress experience for the users by structuring your navigation options. We want to strengthen large trial engagement and present you the newest data of trials that can actually change your practice in the future. We are going to innovate somewhat on session formats and stage design, and I'll get back to that later. Improve accessibility for some underrepresented regions. So we do see that some of the regions where many of our members are located are not adequately represented at the conference, and we want to change that and make that right. And we want to actually know what you want. So we are strengthening currently our market research. The EAU has hired somebody to do market research and get membership insights so we can shape the conference in the future to your needs specifically. To enhance your user experience and elevate your navigation experience, we have come up with tracks this year, albeit not completely an original concept. I do believe that using these tracks will guide you through the conference in an easier way and will reduce the clutter or the chaos or overlap that some people have experienced when navigating through our conference previously. So you can use these tracks in the app or on the website. And if you click one of these, you can only see the sessions that handle the topics that are noted in the tracks. In tracks, we try to bundle topics that are very abundant at the conference. So if you click a track, you can probably spend 4 days with going to sessions only of that track. Obviously, urology also has a lot of topics that are somewhat more niche or somewhat less common. Infections, transplantation, trauma, some specific topics like trial and progress, skills and professional development, and these also can be clicked in the app and on the website to specifically find those sessions that deal with those topics involved. We want to strengthen large trial engagement. So we have a game changer platform since a couple of years. These are sessions that are in the plenary room and that are directly following up on the plenary sessions. And this year we had game changer publications that had embargoed publication in Lancet, JAMA, Lancet Oncology, and our own flagship journal, European Urology. And we saw that we had really major trials that could be practice changing, presented for the first time their primary outcome data at EAU. And we want to engage with both pharma and also investigator-initiated trials to further expand on this platform and to get more game changers into the EAU so we can keep you, the membership, updated on data that really, really matter. We're going to, let's say, rejuvenate also a little bit the EAU. You know that the plenary session rooms have been similarly set up for many years now, and we're going to change a little bit our stage design to adapt some new formats that we will explore this year in EURO 2. These are, for example, live podcast recordings, talk shows, debates, real debates, not slide-based talks, but real people going into debate with each other, with rebuttals and a good moderator that guides these discussions. We will have keynote talks, think about TED-style talks, and we'll also work with an interview format where people will be interviewed live during the sessions, and this will be broadcasted for our audience to see. So we hope that with these innovations, we can keep the Congress lively and dynamic. Here's some statistics on the abstracts over the past years. You can see that in Madrid, we had a record-breaking number of abstract submissions. What is important for this webinar, I think, is that you can see that the number of abstracts that we receive keeps increasing. And we are in a 4-day platform, so that means that we also have to make more sessions in the same number of days. The abstract rate has been stable around 30% for many years now, so about 1 in 3 abstracts get accepted. And the way we deal with an expanding number of sessions in a limited infrastructure or space is by increasing the platform expert-guided poster tours. So we want to professionalize this platform a little bit, and these sessions will be held at a space in the conference where it's really central to all the session rooms. Because if we have to accommodate next year, if we follow the trend, more than 6,000 submissions with 1,900 abstracts accepted, we have to find some ways to get all these abstracts presented in a decent way to the audience. These are just some statistics for your information because they may interest some of you. This is how many attendance we have over the days. So we see the plenaries fill up very early in the morning, and then we see Friday, Saturday, Sunday being popular days, with the live surgery being in an absolute favorite of our audience, and about 30% of our audience attends our abstract sessions. We sometimes get the complaint that we have a lot of oncology at the conference. This is absolutely true, but we do cater to all fields of urology. And on the right side here, you can see the distribution of submissions and topics placed at our conference. And you can see that oncology is indeed about half of the abstracts. If we make sessions, and you can see that on the left side, however, the topic is not really important to how many people attend these sessions. We're about 150 people for most of our sessions, with some outliers here and there, not depending on the topic. If you want to submit to EAU, this is the timeline you have to keep in mind. You do your research, you produce your data. November 1st is our submission deadline. In November, 450 reviewers will review your abstract or video, and this is on average, we try to have 5 reviewers per abstract. In early December, we convene as the scientific office and we compose abstract and video sessions based on the selection made by the reviewers, with an acceptance rate of about 30%. In late December, the selection outcome is communicated. There's also the option for late-breaking deadline. This is not an extension of the regular deadline, but this is really a deadline for data that have not been available at the time of the regular deadline and that may be practice-changing or at least represent prospective large-scale investigations. And then we hope that you will be able to present your research in London. So today's webinar is about exactly that, how to present your research in London. We'll start with Kari Tikkinen, who will be talking about drafting an abstract for acceptance. Then we go to Peyronnet, who will teach you how to convey your message during a presentation of a poster or an oral presentation. And we'll finish with Frank. What's the recipe for a successful video abstract? So how do you compose a video for it to stand a chance to get accepted at our conference? And then we'll have hopefully some time for questions and answers. So if you have some questions, please don't hesitate to type them in the chat. We'll answer those that we can answer in the chat, and we'll keep some of the questions that we believe are of interest to a broader audience for discussion after all speakers have given their talks. So I'll give the word to Kari, and Kari, if you would please share your screen. Thank you very much.
Thank you very much, Martin. And good evening, everyone, or wherever you are. I saw the list of names, and they really represent the whole world. I saw some of the friends also on the, so good to see you. I'm not surprised that Martin gave a good start for this. It's a really pleasure to work with him in the EAU Scientific Office, which he is very nicely leading. So I was asked to give a talk on drafting an abstract for acceptance. So I would start like why this really matters. Obviously, abstracts are important part of sharing knowledge. So unfortunately, actually, half of the abstracts roughly never get published in a full text. So actually these abstracts represent very important information piece. So sharing knowledge for colleagues, like to improve science and care of our patients, obviously is very important. But abstract can also be very important for your career and for your development as a researcher and a doctor. You kind of give your first impression with your abstract. It can open your doors. So you can if you do a good job with your abstract, you get some visibility and credibility, which can be important for your future publication. Maybe editors see your work, or when you present the work, maybe sometimes you get good comments and you can improve your future work. And obviously, you meet those people who are interested in the same area. You can then create collaborations. Also, funders are interested that you share your knowledge in the national, international meetings, and you can get invited to talk about your work, which truly interests you, which is important for you. So it's very important. It's your first impression. Then, when you prepare your abstract and your posters and your presentations, clearly you become a better expert. It sharpens your thinking, it improves your science. So abstracts matter also for that way. But as Martin said, probably in London, we will get more than 6,000 abstracts submitted. We will again accept a maximum about 30%, which means that we will reject 70%, which means that thousands of abstracts will be rejected. So it really matters how you write your abstract if you want to get accepted and presented your work. So what EAU abstract reviewers then look for? Obviously, it needs to be urology. It needs to be relevant for our field. Maybe it's a general big question in urology, or maybe it's a niche question. But anyways, it needs to be relevant for urology. So then you need to do your research well. So you need to do, you have a good study design, and you should have some novelty. But then in the end of the day, research is often about storytelling. You need to tell a story, and you tell a story with a clear, structured way, without jargon. Again, of course, in every meeting, you need to adhere to the format. In this case, it's EAU guidance. We have the guidelines, and you need to adhere to the formats. And as Martin just showed you there's only about 3-4 weeks for reviewers to go through thousands, and every abstract is about 4 to 6 people are going to go through it. It means they are busy. They can be often tired clinicians. So if you don't clear well, you will lose the game. So clarity wins. So be clear with your abstract. Then they will rate the abstracts, those reviewers, from 1 to 5. And we very rarely see those exceptionally high, which give the 5. We see more those 2, 3s, and 4s. And as you can imagine, most of the all those who are poor or fair will be rejected, and also some which are good either can accept it or reject it, depending a little bit on the field and how much there's competition, because only 30% will be accepted. So what should you then do? Like, what should you include in each section? EAU abstract follow this so-called IMRAD format, which is introduction, methods, results, and discussion. We call it though conclusion, but it's an IMRAD model. And so first is, of course, the introduction, and you should keep it short, but straight to the point, clearly tell quickly the background, and end with your research question. Secondly, you tell briefly the study design, population, intervention, and key methods. So what did you actually do? Then what did you find? And here we could have a lot of improvement, I think. You first of all, present them clearly, tell the effect sizes if possible, not just p-values, use confidence intervals when they are available, because they are usually better than p-values, or use p-values. And if possible, try to illustrate with figures or tables your results. And then in the end, you need to summarize your message. So you need to answer the question, so what? So then you tell first your message, how certain you're about it, or what's the broader implication, your findings for research or for clinical practice. So let's see some of the examples from this year's. This is the Madrid 25 meeting abstracts. So this is the introduction of one abstract. I think it does a relatively good job, I would say, or actually quite a good job, except the Gleason grade 2, maybe it's a grade group 2. So first of all, it takes that uptake of active surveillance with grade group prostate cancer remains slow. Okay? It gives to the background. Then it tells that integration of MRI would allow better patient selection, but there's no data. And then it tells that this is the first European series of active cells. It's clear what they are doing. So they did a good job. They tell why this matters. So another abstract. This is about the methods. So first, study design, population, intervention, key statistical methods. You don't want to tell too much statistical methods in a conference abstract. They will be then in the full manuscript. So they tell this is a retrospective study evaluating men with open rectal fistula repair. They tell the years. So that was the study design, and that was the population. And then they tell that there's no randomized trial. This is an observational study. So everybody got the repair, and then they tell the outcomes, which is very good. I could probably include it in that slide that you should always have the outcomes. I come to that the later. So they have the endpoints such as fistula recurrence-free survival. And the key statistical methods, Kaplan-Meier estimators, and patient-reported outcome measures scored occurrence standard. So this is a good job. How did you do it? How did you do it? Your study. What about the results? So this is a randomized trial. This tells clearly the findings. First of all, they tell, I'm not sure if I would start, but they do a good job. They tell you, okay, they are the bone protecting agent used versus no bone protecting agent used, similar baseline. So this is in the methods they told that this is a randomized trial. And then what they do a good job here, I think, median enzalutamide treatment was 12 without and 26 with, okay, a little bit. And especially if you look at the third sentence, median progression-free survival longer 14 from 13 to 27. So they tell the absolute difference between the arms, which is very, I think, more patient-friendly, patient important than the relative effect, which also they give hazard ratio 0.61 with confidence interval. This is something what people often tell with only, but they don't tell the absolute effect. So they do a good job. They tell both. And then they go through a couple of important outcomes for efficacy outcomes. And in the last sentence, they tell the key side effects or adverse effects also for both arms. So in this slide, I don't show now the figures or tables, but you could illustrate them also very nicely. I think this is a good thing they did. Clearly the findings, effect sizes, both absolute and a relative effect. They use confidence intervals, and that's a good job. This was obviously a good study overall. So what about then the conclusion? So first, this is a little bit more, I chose a little bit more difficult area. This is a little bit experimental study, early evidence. So you don't make very, very strong conclusions, but they tell that this is another fourth study. So they tell that there's key differences in the cellular composition in the tumor microenvironment between peripheral zone and transitional zone cells. And they tell that PZ tumors are greater immune heterogeneity, while TZ are more stable. And then they tell what does this mean? It means that some has more worse outcome prognosis than the others. And then they give what's the implication maybe for the future targeted approaches. I think this is overall a good job from a preliminary study. But so those were the good ways to do it. But what about the killers? Here's maybe 8 killers. I'm sure you can kill your abstract many other ways too, but these are some of the most commonly done killers. First of all, you have a very vague title. So, or it's very unspecific. Readers don't even know what is this about. You want to be avoiding buzzwords and you want to be specific. So secondly, if you don't tell those population, design, and intervention in your methods, you are going to be rejected. Also, if you don't tell the background, the objectives, why or the methods properly, readers don't know what was actually done, and they will be like, I can't accept this because I don't know what actually was done. Maybe one of the easiest way to get rejected is that you don't have data. You said the data will be presented. That's not acceptable. You need to get the data first. Come to EAU 27 if you don't have yet data. So you must show the data, not promises. And typical also is the overinterpretation. You a basic science study, you are saying that this is a new drug if it's not even used in humans, for instance. You can't tell, but you have to tell that this is a promising for future studies. So if you don't conclude beyond the data, stick to what the data actually shows and where's the data from. Obviously, if you don't follow our guidelines, we will easily reject you. I think language issues are now, since AI, they are much less relevant. Like I have been here in 5 years doing these things, and I think last 2 years we have been clearly better English thanks to AI. But so there are sometimes still language issues, and so that's nowadays quite easy to avoid. So these are some of the abstract killers. Don't do them. So a couple of last slides. So first of all, maybe the most important one line of your abstract is the title. So again, be descriptive and informative so that people know what your study is about. Tell the population, intervention or exposure, outcome, and design somehow in your title. It's a little bit long title, but I would still prefer the first one clearly over the second one if you look at the examples. It tells impact of early versus delayed catheter removal on post-op complication after robotic prostatectomy, a randomized trial. Everybody would know what is this about. This is more like a magazine style. It's earlier always. Better lessons from catheter removal after prostate surgery. You don't even know if it is what kind of prostate surgery. So you don't know what's earlier or better. Maybe you know catheter removal, but still, I would prefer the first, even though it's longer. Last slide, conclusion slides. first of all, follow EAU abstract guideline exactly. Consider using checklist. If you go to www.equatornetwork.org, there's Consort, Strobe, and Prisma. Consort for RCTs, Strobe observational, Prisma for systematic reviews. And they have also the abstract version of the checklist. You can get guidance how to do it. What should you include there? You can use that. And then when you and your research group have done the abstract, if you don't leave it to the last evening, like most of the abstract submissions actually do, you can show it to your colleagues and somebody outside the group who can read it through. And sometimes they give you very valuable because they see it outside the box a little bit. Start early and then edit a lot. You will get a very nice abstract. That way, don't leave it to the last second. And maybe my last message is that please try to publish in a peer-reviewed journal. There's a lot of EAU abstract which we never see in the full as a full paper. It would be very nice that we would, because you have done the work, so then also publish in the peer-reviewed journal in the end of the day. I hope this was somehow helpful, and I know next presentation by Benoit is going to have Porsches and all kinds of beautiful pictures. So I'm very happy to stop here and continue, and looking forward to Benoit's presentation.
Thank you very much, Kari, for a beautiful presentation, very insightful. As Kari said, we have many reviewers who are short in time. Just a little insight from our side, your average score needs to be higher than 3.2, 3.3 to get accepted. And I can assure you that by and large, the bulk of all abstract hovers around 3. So something has to spark these reviewers' attention. And once you get in, then Benoit's going to tell you how to present those data that you've worked so hard to get into the conference. So Benoit, please, some tips and tricks from your sides. And please, if you have questions, don't hesitate to use the question and answers box.
Thank you, Martin. And good evening, everyone. I'm sorry my voice is a little awkward, but I hope you can hear me. I'm very, very glad to get to be with you all, and thank you for attending. So yeah, I guess my talk is complementary to the one that Kari just gave. And yeah, once you got your abstract accepted, I think Kari stressed that most of these abstracts get rejected, but Martin also stressed that 1/3 of them will get in. So you still have a good chance to join us in London to present your work. And once you get there, how to convey your message. So the key message that I have to give you is something that I learned when I spent 1 year in New York. They told me this concept of blot, which is also called bluff, which is bottom line on top or bottom line up front, meaning you don't want to hide the main thing that you want to bring to the audience somewhere. You want to put it in the front line. And so how to craft a good bluff or a good blot? First, you have to identify the key message for your reader and why they should care. Step 2, you have to summarize it and to make this synthesis a little bit, 1 or 2 sentences, no more. And step 3, place it at the start of your communication. So what is up front really is, of course, a title. And I think Kari has stressed sufficiently how it's important to have a good title for your abstract. It's also important to have a good title for each slide. And so really, when I create a slideshow, what I want is to have for each slide the bluff or the blot at the top of my slide, like here. It's also true, of course, for a poster, but for the poster, most of the time you would use the title of your abstract. So it's important that you choose a good title for your abstract anyway. So this title for a slide or for your abstract or for the poster, it should be clear, it should be catchy, and it should be summarizing the key message. So of course, for the abstract, it has to be very rigorous. And I think Kari has explained to you how you would draft your title. I think still that we can find a balance between it being very scientific, rigorous, and exhaustive, and still a bit catchy. Because the honest truth is, when I review abstracts or a paper or whatever, the first thing I look at is the abstract, is the title, sorry. and it has to like bring my attention somehow. And for the slides and the poster, it's really the same. So I didn't want to blame anyone. So the bad example, I took them from myself, from old slides that I've done, but I still do mistakes, of course. And for instance, here, an abstract that I presented a couple of years ago at the AUA, you see the title of my slide here is results. Results is not saying anything to the audience in the end. They know it is results. They can see the table. So rather than doing that, what I would suggest you is to put the key message of the slide here, drain versus no drain, similar complication rates and postoperative CTUs as at the top of your slide. Like the key message at the top, again, is the idea of blot or bluff that I apply here. Another example is for the poster. Again, for the poster, you would use the abstract title mostly, but here it's very descriptive, so it's good, as Carrie has said. But so the honest truth is this one, if I had to do it again, I would do it differently. But instead of just saying hemostatic, like very descriptive here, you may bring some sort of a controversial message. Probably I would use a conditional here. I would say the use of hemostatic agent may not prevent complication, but it's a way to catch the audience. Again, for the abstract, maybe not, but for the title of a slide or a poster, maybe yes. So then, very important, and I think it applies to the slides, it applies to the poster, but it applies to anything in life. It has to be visually appealing. Here, clearly, you will probably look more at the Porsche than the Kangoo, although Kangoo, it's a very good French car from Renault, but still, I know all of our eyes are looking at the Porsche here. And it has to be the same with your poster or your slide. You want it to be visually appealing. And that's why I would add, and I would be curious to know what Kai would think about that. But for the abstracts, what I try to do too is to include a table or a figure, because the reviewer is reviewing a lot of abstracts, just wall of text, wall of text, wall of text, and all of a sudden he sees a figure or a table and it's visually appealing. And I think the reviewer would like to see that. So another very important message is to forget the wall of text. This poster is again from me, and I now looking back, I think it's bad. Basically, I included the wallpaper in this poster. This is not what you want to do. Remember, you will have 2 minutes to present your poster and 3 minutes of question. You have to be very realistic about which message you can bring in 2 minutes to the audience. 2-3 key message maximum. So it has to be more visually appealing than that. Same for the slide. This is a terrible slide with only writings, wall of text again. Nobody will read that slide and everybody will have his mind escaping somewhere else, to the beach or dreaming of something else. This is not what you want. So less is more when it comes to drafting and crafting a slide or a poster. Do not overload. Leave a lot of free space, white space. What they call negative space in marketing and communication usually is everything you add on a slide will diminish the attention that the audience can put on the rest of the slide. So this is an example here, only 2 key messages. One is leave white spaces, and the other one is use keywords, not full sentences. Full sentences, nobody wants to read that in 2 minutes. It's impossible. The audience will get lost. So I discovered preparing that session that there is science behind how to create the best possible poster, etc. And especially there are studies using eye tracking to identify where you are looking when you are looking at a poster. And here, when you have a wall of text like this, your eyes are going a little bit everywhere. It's funny to see that they go to the university. They want to know who has done the poster. They go to one image and then they go a little bit everywhere, but they do not stand anywhere really. For another, a better poster, what they call now the better poster is a poster very visual, like here, a lot of spaces, a lot of negative space, a couple of images, a clear title written very big so that everybody can see it easily. And you see, the eyes will go just on a few important spots and they will digest the message much more. So in terms, again, of visuals, clear background are supposed to be better for the brain. So you don't have to worry too much about that because you will use a template from the EAU, which is always sort of clear. But this old-fashioned dark blue slide with green writings on it, it lowers your breath and pulse rate, but it makes you sleepy. So please avoid that. It's from the 90s probably. Don't use that. Same, avoid this eye strain sort of slides. Red on blue is not good. You have to use sharp contrast so that everybody would see. That's also an important message. Never use small characters. Remember that people will see your slide or your poster from afar. So you have to write big, especially for the key messages, of course. Create space. And I don't know if the SEO will agree with me. I hope they will. Otherwise, I'll get fired maybe. But I prefer you to split one slide into two. And I prefer you to have 5 slides instead of 4, but 5 very breathing slides with much less message on it, rather than a crowded slide where nobody can read anything. And a couple of last slides, a couple of last messages is, I also personally believe that having more slides helps you to stick to a very important principle when doing PowerPoint presentation is 1 key ID per slide. This is the most that the brain can cope with. So 1 key ID per slide, no more than that. The 3 takeaways I don't really know, and 2 minutes per slide. This is another PowerPoint rule, but I strongly disagree with that. I think 2 minutes per slide. If I would do that, you would be sleeping already. I hope it's not the case now. And my personal recommendation would be more to do 30 seconds to 1 minute per slide to keep people awake so that you go with the flow. And I think, yeah, changing the slide regularly helps people to stay awake. Remember that text is not visually appealing. So table and figures are much more appealing. So when you want to present your results or even your method, etc., try to favor table figures rather than writings. Icons, probably you know, are the new trends. Everybody are putting icons because it's very visual on their PowerPoint. So I did that for the first time for that presentation, and I will try to stick to that now. And last but not least, the importance of body language. Of course, you see this guy on the top right. Nobody wants to talk to that guy. Nobody wants to listen to that guy. He seems bored, so it makes you feel bored. This guy below maybe is a bit too much, but you want to go and talk to him. He seems very enthusiastic. So do not read your slide. Try to smile. Be polite. Don't be aggressive. Everybody there is here to learn and share. So it's just supposed to be smooth and friendly, and it's always the case at the EAU. And of course, for instance, if you are presenting a poster, don't be looking at your phone like bored. Nobody will want to engage with you. And I like these words. I don't have a French word for that, but being engaging. Try to have people willing to come to you and talk to you and discuss your findings. So take-home messages, use this blot or bluff ID, bottom line up front. I think it's very important. People will be very attracted to your work if you do that. Do not overload, use keywords, free space, figure, and go with the flow. 1 ID per slide. If you have to do more slides, it's okay. And of course, we hope to see you all in London, and please submit your work. We can't wait to review it. Thank you very much.
Thank you very much, Benoit. Again, nice and insightful presentation. For the last part, we'll go to Frank. And Frank is the chair of our video committee, and he will give you tips and tricks on how to successfully submit a video abstract. And after that, we'll take some time to answer your questions. So please use, again, the question and answer box below in Zoom. Frank, up to you.
Good evening. So after all these tips of Benoit, I hope I will meet up to the expectations. So I'm going to try to explain how to successfully submit a video abstract to the annual EAU Congress. I think there will be a lot of things that are in parallel with what we have already said about the other abstract, but still maybe videos can have some specific elements that are important. So I'll briefly introduce the video committee and the video review process. Very important, I think, is to understand how we select the appropriate videos for a conference. So you need to know the criteria. And then some small extras, elements to boost your video, and some of the typical flaws, very parallel to what Kari said on abstracts, and then to conclude. So the number of video submissions has risen over the last years, and I'm happy, Benoit, that I also included some icons in my presentation. They almost doubled over 10 years. I think our absolute record year was 2024, but still we are peaking at around 500 video submissions in the recent years. But luckily, also the number of video sessions has increased in the conference. And so this means that our acceptance rate also has remained stable at approximately 30%, a little bit below 30%. Thanks to more digital recording, more robotics, more laparoscopic procedures, we have an increased number of submissions of these specific procedures, which also means that if you do a good recording of an open procedure, probably you will have a big chance of being accepted because they are more rare and more difficult to produce. So what happens when you submit your video? So first of all, after the video has been submitted, some independent co-workers of the European Association of Urology, they will anonymize the videos so that the reviewers cannot see which institution or which people have made the video. And then 2 to 3 reviewers will independently score these anonymized videos on a web-based platform. And they use different aspects of the video. And I will show you the different aspects that we use to qualify these videos. After that, we meet together and we spend more than a day to discuss on discrepancies between different reviewers, to select the correct scores, and to discuss the different video sessions within the video committee during the scientific office meeting. And I think a very important message that will come back later is that a submission of a video that considers the different aspects of scoring has a reasonable chance of being accepted. And on the other hand, if you forget 1 or 2 of the selection criteria, you unfortunately will have a big chance of being rejected. We score videos on these 5 aspects, and we give them a point from 1 to 5. So this means that a very low video will have a minimum score of 5, and the highest score a video can have will be 25. And I'll quickly run to the different selection criteria to explain what we actually try to have in these criteria. First of all, the video quality. So the first thing that we do is we specifically look at the video footage that you are presenting. So is the video in focus? Is the image well delivered? Does it show the elements of the surgery that we need to see? And is the image well lighted? Isn't it a dark, out of focus image? Secondly, are you including overview shots combined with detail shots? Maybe some adequate textual or graphic annotations, like here, an arrow or wording within the slide, and even picture-in-picture videos or animations, as you saw in this video, which really takes the audience with you on the journey and shows you what you want to show. So think about being an editor and improving the quality of your video to convey your message to the audience. The content, I think this is very likewise to abstracts. Question yourself whether the content you're presenting in the video is of interest to a large urological audience. In videos, we always risk to have some footage that shows things like, look what I can. So is what you're presenting here a reflection of clinical practice? If you want to show some complex cases, is this relevant to the audience? Can you show a series of these surgeries that give some extra information to the audience? And even presenting a common practice can be very interesting as a content if you can present, for example, large series that show the results and the figures of this procedure. And maybe content can also be potentially practice changing, and that can be impactful on the practice of the people that come to see the videos. We also score on innovation. A video that represents an old technology that is outsourced, outdated, probably has less chances of being accepted than a well-presented video on a current practice that is interesting to the majority of people that are in the room, or even novel techniques that might have an impact on the future practice of the people that will be in the conference. So this does not mean that we always have to have the highest innovative techniques. A good presented video of a current practice can also be very interesting. We also look at scientific merit. If you present a case, please also give the data on follow-up, on outcome of this case. Case reports always score quite low on scientific value. So if you present cases, please also present the case series that is behind your experience. Show us the outcome of the specific procedure and give us some data so that we can evaluate your scientific merit on this subject. We do understand that sometimes we see very rare cases and it's hard to present outcome data on a large series, but still then it should be mentioned and you should present the outcome data on the cases that you have done in the past months or years. And then last but not least, we consider the educational value. Same here, we want to assess whether the information that you have presented in your video is informative for the urological audience that we expect to see in our auditoria. And we want to recognize if cases bring clear insight into a technique or a pathology, or that can convey new or difficult information in a concise way. So I think it's very important to consider these 5 aspects of criteria on which we select a video. How can you boost your video? Well, I have made 3 guidance sentences. First of all, show us the way, add annotations, highlight key anatomical structures, use colored flags, use arrows, use texts. If possible, include some animations or anatomical drawings on the side top of your video. It will increase the quality of your video and the educational value. If you show us a procedure, label the steps of the procedure, organize the video clearly so that the audience can follow each step and they can follow what you're presenting here. Secondly, give us the late night DJ voice. Speak slowly, give us a calm and clear and slow English voice. Often we hear very fast, difficult to understand voices that make the video harder to interpret for both the reviewers and the audience in the room. And then last, I already mentioned this, please show us the data. Often people present data in their abstract, but they forget to present the data also in the video. So give a clear introduction on the case, give a clear outcome data on the specific case, and then end by giving us the information on the case series or the study or whatever you're presenting in the video. And that will increase your points on scientific merit and on educational value. And so that will increase the possibility of being accepted. Typical flaws that we see on the lower end of the video quality. we see a very nice presented surgery, but there is not a single follow-up date slide. So we don't know if the patient survived the surgery or if they did well after a few months or weeks. Also, although we know that probably the institution has a large series performed, there is not a single slide or not a single part of the video presented on the series. So the video ends abruptly at the end of the surgery. And that means that the reviewers will give you a very low 1 or 2 score on educational value and on scientific value. And if you miss 1 or 2 of the evaluation scores, you will probably be rejected. Second, we see a lot of footage on accelerated surgical procedures. So they give the video on a ×2 speed without step-by-step explanation and without annotation. So even an experienced surgeon cannot follow the surgery that he or she should know. So please guide us through the steps of the surgery. And this will give, if you do the accelerated surgical video without step-by-step, you will have a low score on video quality and a low score on educational value. And then last but not least, you will not get punished on scoring, but think about copyright. A lot of music of modern artists is copyrighted, and actually you're not allowed to use this music in a public platform unless if you ask copyright admission to the owners of the music. So conclusion, submitting a video abstract takes an effort. Think very well about what key message you want your audience to remember, to take home, and then ask yourself whether your video clearly conveys that message. Read the instructions and pay attention to all 5 evaluation domains. This will really bring you up front of a lot of other people. It will take you a long way. Scoring very low in even one domain might significantly reduce your chance of being selected and accepted and presenting your video. And then last but not least, it's not very difficult. So I think if you really follow these guidelines, you got a good chance of being accepted. And I wish all the people that are here very good luck and a lot of energy. And I hope to see a lot of your videos, and obviously also for the other presenters of the abstracts in London next year and the years thereafter. Thank you.
Thank you very much, Frank, again for a very insightful presentation. Lots of very concrete tips and tricks to get your video accepted. I will take the first question that was posted in the Q&A box. That was, can I use AI, or really is there a check for AI done by the EAU? And the brief answer is yes, you can use generative AI as long as it's only used for enhancing the readability of your work with human oversight. You should disclose the use of generative AI. It cannot be an author, and you need to take full responsibility yourself for the contents of the abstract. Second question is, what would be the perfect timeline towards a Congress, abstract presentation, and so on? Kari, would you like to take that one?
Oh, okay, I can. So, I mean, first of all, the question, I was a little bit actually thinking what's the question means. Is it about when to write, when to submit, or when to prepare the presentation, or where actually book the travel or anything like? I think those kinds of things are relevant actually. So obviously the deadline is 1st of November every year, and right, Martin, and
Yep.
So you need to prepare by that your abstract and submit by that. The earlier, this is my personal view, but we increasingly do work so that paper is kind of ready. We submit to the journal and EAU often same time, but I know that majority probably submit the abstract first and then later to the journal. That's also okay. There's both can be done. But I think the earlier you prepare, the better. Then you can share to your co-authors, and then you get feedback, and it becomes better. So now it's good time to start working on your abstract and submit during the fall. Then when you get the access, and by the way, if especially the hotels and things are getting more difficult and more expensive for many people, the earlier you book the hotel, the cheaper. And you can cancel that if you get rejected. And regarding the presentation, obviously we have the deadlines during the winter when you should submit that so that you can get to the shared USB, the poster, and those kinds of things. So try to do them early during the winter so that you don't leave it to the last month. So abstract you can submit quite late, but the posters and presentations should be done a little bit earlier. And the earlier you prepare, the better. By the way, some quick comment on Benoit's great presentation. I think one of the easiest way to make your slides better, if you don't have energy, which I hope you would have energy to make pictures and figures and tables, but if you don't, and you still do these boring text slides, then at least don't use verbs. Use verbs as little as possible. So verb-based are less effective. For instance, if you want to say something like, we compare cystoscopy and cytology for diagnostic accuracy, you can just say cystoscopy versus cytology, diagnostic accuracy. Or if you want to say we analyze bladder cancer incident across different age groups, you can just say bladder cancer incidence by age group. You can almost always leave the verbs out. And that way, people will get it. And of course, when you talk, you tell the whole sentence, but you just give the keywords. But did I answer the question, Martin?
Yes, and more. So the other tip is if you get a question, always answer the question. So Frank, I have a question for you. We have all been there. We were young and we were presenting our first abstract, and then an authority in your field stands up and walks up to the microphone asking you a very difficult or complex or annoying question. How do you deal with that situation?
Yes, it happened to all of us and it will continue to happen. I think the first thing you do is you acknowledge the speaker. You thank him or her for the question. Always be polite. And then, well, I think it's important to give an answer. If you cannot really answer the question based on the data that you have presented, I think that's an easy way out. You can just explain to the person that your data does not allow to answer the specific question. And if it's a weak point in your presentation, I think you also should just acknowledge that this is a weak point and you need extra research, or you could look into that matter. And if you do have a clear answer, you can just answer the person. So don't be intimidated by the authority.
Frank, just a brief another question from the Q&A. Is there a limit for video duration? How many minutes can your video be? Just short answer.
Yes, 8 minutes is the limit. Very, very simple.
There you go. Benoit, what is the secret ingredient to get your abstract accepted? Would it be data depth, catchy title, as you mentioned, blind luck? What's the one, if you would single out one of the most important things to get your abstract accepted, what is it according to you?
Again, catchy title, and try, as Kari said, to find the energy to do one table or one figure, because again, it will catch the attention of the reviewer. So that's the one I use. I've not always been successful, but that's the one I use.
Okay, and finally, I think we're almost 1 hour, so we have to almost close. Kari, what do you do if you get your abstract accepted? You're just out of medical school or a young urology resident. It's your first time at an international congress. What are your tips and tricks how to cope with stress just before you go onto stage?
I think Germans would say Vorbereitung, Vorbereitung, Vorbereitung. And so as English would say that, I think, first of all, urologists are nice people. They are not going to kill you. It's going to be fun. But of course, you're going to be nervous. And if you want to be less nervous, not only prepare a good poster and good slides, but practice. Practice, and so that with timer, you'll see that you have these 3 minutes time that you actually practice several times, that you know that how do you use. So don't only focus on your poster and slides, but focus also on your presentation. And then you can always ask Martin and Albersen to help. So that's also a good way to get a little bit relaxed.
Okay, I would like to thank all three of you for really fantastic presentations. I think people will have a lot to learn here and a lot of concrete tips and tricks. We will repost this webinar as well just before the abstract deadline so that people can rewatch it and see what we use to assess the quality of their abstract and what makes a successful abstract. So thank you for your time, Benoit, Kari, and Frank. I really appreciate that you were here tonight, and I hope for attendees that you had a nice and insightful webinar. So thank you for being here.